Why 24-hour critical care nursing is a lifesaver for a ventilated tracheostomy child at home. My name is Patrick Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, where we also provide services for families who want to go home from ICU with a loved one with a tracheostomy and ventilation. Those are adults and children. In essence, we're providing a genuine alternative to a long-term stay in intensive care for predominantly long-term ventilated adults and children with tracheostomies, but also with a tracheostomy without ventilation and ventilation without tracheostomy, such as BiPAP or CPAP. So today I want to talk about why having critical care registered nurses, CCRNs, available 24 hours a day is a non-negotiable life-saving necessity for a child with a tracheostomy and mechanical ventilation. Like we just had recently an inquiry of a family who has a 9-year-old son who spent a lot of time in ICU, and now it's at the point where, an independent nursing assessment has been done by another highly qualified critical care nurse, and also a doctor's letter has been provided, and the verdict is crystal clear. This child needs 24-hour critical care nurses, not registered nurses without intensive care experience, let alone disability support workers. That would be like flying the airplane with a cabin crew instead of the pilot, because a CCRN is not just any registered nurse. They have a bachelor's degree in nursing, ICU experience, acute care experience, and a 1-year postgraduate degree in critical care. This specialized training gives them advanced skills in areas like airway management, ventilation, and tracheostomy care. So in a hospital, most patients with tracheostomy and ventilation are in ICU, or if they come in, they go through ED. But any other area outside of a hospital, apart from ICU, would be unsafe, could be devastating, could cause a patient to die. All CCRNs have annual advanced life support accreditation, which includes advanced airway management and resuscitation. For a child like the one in question who has complex medical needs, a CCRN's expertise is crucial for survival. Here's why. Tracheostomy and airway management. The child has a permanent tracheostomy tube because he has a weak respiratory drive, central sleep apnea. That basically means he stops breathing during his sleep, and problems managing his secretions. And with a tracheostomy, that means regular suctioning can be performed. Once again, regular suctioning through a tracheostomy, through an artificial airway, needs to be managed by critical care nurses and not by general registered nurses that ICU experience, let alone support workers. That could be dangerous, and people have died because of it. Without the tracheostomy, this child would not be able to breathe effectively and would die. The tracheostomy tube itself poses several risks, including blockage or dislodgement, either of which is a medical emergency. A CCRN is trained to recognize these issues quickly and perform an emergency tracheostomy tube change. A general registered nurse or a support worker lacks this advanced airway training, and an emergency would require calling an ambulance and attempting to provide manual breaths with a bag and mask while waiting for help, which could lead to further hypoxic brain injury or death. Next, mechanical ventilation. The child requires mechanical ventilation overnight due to his central sleep apnea and unexplained episodes of low oxygen levels, also known as desaturation. The management of a mechanical ventilator requires specific knowledge that only a CCRN possesses, including understanding disease processes, gas exchange, ventilation modes, and alarm limits. This advanced knowledge allows them to understand and manage mechanical ventilation safely. And I know of at least 5 to 8 deaths in the last 10 years in the community where either support workers or registered nurses could not manage ventilated adults and children with or without tracheostomies, and clients passed away before an ambulance could even help. And we all know the NDIS has been very busy sweeping these deaths under the carpet so they can, not be held accountable. But this is all about accountability. Next, risk of aspiration. Because of his tracheostomy, the child is at high risk of aspirating food or secretions into his lungs. This risk is heightened when eating or during oral hygiene. 2 staff members are needed for oral hygiene, with one being a CCRN to perform suctioning to prevent aspiration. Additionally, when a speaking valve, also known as a Passy-Muir valve, is used, the cuff on the tracheostomy tube must be deflated. If the cuff is mistakenly left inflated, great son would be unable to breathe. The cuff's deflation also carries a high risk of aspiration and tube dislodgement. A CCRN is competent to manage this process safely. Next, Challenging behaviors. The child's hypoxic brain injury has resulted in impulsive and challenging behaviors, including pulling at his tracheostomy tube. This puts him at even higher risk of tube dislodgement or accidental removal, a scenario that demands the immediate advanced airway skills of a CCRN. Without a CCRN 24/7, such an emergency could lead to further brain injury or death while waiting for an ambulance. And if an ambulance comes, there's no guarantee the ambulance is tracheostomy and ventilator competent. As a matter of fact, most ambulance crews are not. That's why it is also so important to have 24/7 intensive care nurses and critical care nurses in the home when it comes to ventilation and tracheostomy. But also when it comes to tracheostomy without ventilation or ventilation without tracheostomy. And this is, by the way, all evidence-based. Not only is it from an independent critical care nursing assessor, it's also evidence-based. When you look on our website at intensivecarehome.com, you will find a section, the mechanical home ventilation guidelines. And the evidence-based mechanical home ventilation guidelines clearly say that only and exclusively critical care nurses with a minimum of 2 years critical care nursing experience are safe to manage ventilation and tracheostomy at home, also tracheostomy without ventilation, also BiPAP or CPAP ventilation at home. And that all must be 24 hours. And this evidence comes out of over 25 years of intensive care at home nursing in Germany and over 13 years of intensive care at home nursing in Australia. Next, continuous monitoring and proactive care. The client's condition requires constant monitoring of its oxygen saturations, especially at night. A CCRN can proactively recognize and treat issues like increased secretions, which can prevent chest infections, hospital admissions, and even death. The death of a patient with a tracheostomy tube blockage or dislodgement is a very real and serious risk that can be avoided with a CCRN in attendance 24 hours. For a child with such complex high-risk needs, providing a lower or quote-unquote cheaper level of care is not a reasonable option. Relying on ambulance services, which often experiences significant delays and has no ambulance crews, generally speaking, that are tracheostomy and ventilation competent, which often experience delays, could cost the child's life. A 2019 report on deaths in Australia using disability services found that delays in diagnosing and treating respiratory illnesses were a concern, and that staff were not always confident in responding to medical emergencies. Providing 24/7 care by CCRNs is the only way to ensure the child's safety and well-being at home and in the community. It also supports his development and emotional well-being by allowing him to be at home and attend school. Now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care, tracheostomy care for clients without ventilation, home care services for patients on non-invasive ventilation such as home BiPAP, home CPAP, home TPN, which is also known as IV nutrition, home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We are providing central line management, peak line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home, the use of cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families and by a team of dedicated intensive care nurses in the home care setting instead of in an intensive care unit. With intensive care at home, we are currently operating all around Australia in all major capital cities as well as in all regional and rural areas. We work with NDIS clients all around Australia, TAC and WorkSafe in Victoria, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are having policies and procedures for intensive care at home nursing, and we've built all the intellectual property for intensive care at home since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. So if you're at home already, and if you're watching this, or you're stuck in an ICU long-term, or if you're going to hospital and ED all the time, and you realize that you don't have the right level of support at home, or if you are stuck in an ICU, I'll give you a real-world example today how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a client at home on a ventilator with a tracheostomy. That is dangerous and it's simply negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with the cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of dedicated critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecarehome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So this client at the time found out about us eventually, and the ICU that he was basically living in also knew about us and eventually reached out to us. And we were proving our concept with this client very fast. When we worked with this particular client, we sent him critical care nurses 24 hours a day, and he never ever went back into ICU ever again as long as we were working with this client. We can do the same for you if you're not safe at home and help you with keeping you at home predictably. Otherwise, we would not be in business. Again, the same is applicable for those stuck in an ICU, similar to this case study that I've just given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you need more evidence for nursing care, we are also writing NDIS nursing assessments with legal nurse, critical care consulting nurses. If you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. You can join this high-performing team if you are a critical care nurse. If you are looking for a career change as a critical care nurse, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are so vulnerable and so special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building solid relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients, or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or for home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US and in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website, or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.